Good morning, everyone. Thank you very much for joining us. Today is a very special day as we have a guest with us. We have Dr. Fareen Koorjee, a naturopathic doctor or a naturopath, depending on what country you're in. She's also a really good friend of mine and a great mentor. So she is, as a naturopathic doctor, Dr. Fareen Koorjee engages an integrative and holistic approach to medicine by drawing on her 4 years of medical school, training along 2 years of studies in traditional Chinese medicine and Ayurveda. In her approach to care for her patients, Dr. Fareen uses the latest, most advanced diagnostic tools, laboratory testing and imaging combined with a thorough health history to understand each patient as an individual, uncover the underlying cause of their illness, and create an individualized treatment plan. She draws on modalities of nutrition, Eastern and Western botanicals, and mind-body practices, naturopathic needling, constitutional cupping, IV therapies, and when necessary, pharmaceutical interventions. So today we're going to be talking about how mood plus food equals all good. We're going to be talking about women hormonals. I'm Fatima.
I'm Fred.
All right, let's bring in Fareen, Dr. Fareen. Hello, Dr. Fareen. How are you? You're muted.
Hello. Thanks for having me on. I'm excited to be here.
Hi, we're excited to see you.
Thank
Excellent.
you.
Can you tell us a little bit about yourself and what you do?
Yeah, I'm a naturopathic doctor. And for those of you who don't know what that is, just because it is a relatively new profession in North America, I have 4 years of medical school training. So the way that I'm able to diagnose is from both a Western medical perspective, and I generally call that conventional medicine, but then I also use tools from Ayurveda, traditional Chinese medicine, and naturopathic medicine to understand a patient's constitution, to look at their imbalances, and to really understand what's going on with their health. And so I'm really have done 4 years of kind of conventional medical school, and then added on 2 years of botanical medicine, 2 years of homeopathy, 2 years of nutrition, and 2 years of traditional Chinese medicine and Ayurveda. So it's kind of like a specialty on top of
12 years, I know. That's a lot.
Yeah, it's a lot of school. But I feel like it gives me a lot of different perspectives to draw on to really understand where a patient is at and in terms of their health. And, you know, it's a little different than conventional medicine in that with conventional medicine, if you have a patient who has, for example, high blood pressure, they'd have their symptom as high blood pressure, and the doctor would give them a pharmaceutical for their high blood pressure. If they have something else, then they get another pharmaceutical, and they have another symptom, they get another pharmaceutical. And for me, the reason why I chose to go into naturopathic medicine rather than conventional medicine is because I saw a problem with that. You know, as soon as you take off the pharmaceutical, the symptom comes back. So you're not really doing anything to heal the person. And with naturopathic medicine, it really is a medicine where the doctor is spending a lot of time to investigate the underlying root cause of why that patient has that symptom. And once we address that underlying root cause, the symptom goes away, and the patient doesn't need to be tied to pharmaceuticals or to supplements long-term. So that was kind of the reason why I'd sort of chosen to take this route rather than the conventional route.
I knew we were friends for a reason.
I like that approach so much.
Yeah, it makes sense to me. It really makes sense. It doesn't make sense, you know, I understand that treating symptoms is important. For example, if you're in pain, you want to provide some relief to the patient. So it is important. But if you're not actually healing the person and you're just layering pharmaceutical on pharmaceutical on pharmaceutical, you're not really doing anything to heal the person. And so with a lot of my appointments, my initial appointment is an hour and a half long, and my second appointment is also an hour and a half long. And so I'm doing a really, really thorough investigation to understand the patient's health history and really understand what has got them to this place, so that we can uncover layer by layer and then address each layer to get them to their best health.
So what area do you focus on primarily? Do you have like do you focus primarily on women or men?
Yeah, so I have patients of women and men, but my focus and my passion really is women's health. And so I've done a lot of additional training in women's health. So I'm able to do PAP exams, clinical breast exams, imaging for, endometriosis or fibroids or ovarian cysts. I work a lot with women to balance their hormones naturally, or with bioidentical hormones. And then really, the root cause of most sort of modern illness really stems at the place of the gastrointestinal tract. So regardless of what is going on for the patient, a lot of what I'm doing is also addressing gastrointestinal health, balancing the microbiome. So that's a big part of what I do as well. So gastrointestinal health is another place where I have a lot of focus. And then with gastrointestinal health comes a lot of autoimmune conditions as well, because 70 to 80% of the immune system is located in the gastrointestinal tract. So a little bit of a few different things, but my passion is women's health. And just in addressing this kind of medicine, we really have to look at the gastrointestinal tract as well.
Excellent. So you actually mentioned microbiome, and I know not many people do know what microbiome is, as it is a relatively new term.
Yeah.
Can you explain that to our viewers?
Absolutely. So the microbiome, so what the latest clinical data is showing is that within every person's gastrointestinal tract is thousands of beneficial bacteria, viruses, parasites, fungi, that are really important and essential for every single physiological and biological process of the body. So without this healthy, robust, balanced microbiome, we aren't able to carry out all of the necessary biochemical and physiological processes of the body. And what was interesting to me, one thing that I learned in medical school is that when the human genome was sort of planned out and sort of understood, what they found was that humans have 20 to 25,000 genes. And when they looked at the number of genes in a grain of rice has 40 to 60,000 genes. Wow. And that was surprising to me. Yes, it was super surprising to me that a grain of rice that has no cognitive function, that has no heart or complex organ, has almost 2 to 3 times more genetic material than a human being. Wow. And the reason for that is because more of 150 times more genetic material is contributed by this microbiome. So we only have, as a human being, we only have 20,000 genes of our own, but in order to undergo and carry out every single biological function, we need the additional genetic material that's provided by the microbiome. And there's 150 times more genetic material that's provided by the microbiome than our own genes. So in our bodies, we have more cells and genetic material that is the microbiome than really is our own. And so it makes some people wonder, is it really our own bodies, or is it actually, are we actually surviving on a microbiome that contains all that genetic material? So it's kind of this interesting new, it's all the new research is kind of pointing in this direction and showing us.
That's very interesting. Wow.
Yeah.
I'm a bit as we're talking, which is a good thing.
So it's important to nourish those microbiome, eat a healthy diet.
Absolutely.
Whole food, alkaline food versus acidic food.
Yes.
Nourish those microbiome so we can have a stronger immune system.
Absolutely. Yes, it's important for our immune system, and it's important for all of our hormones and our neurotransmitters, which are the hormones that are made in our brain. And our hormones and our neurotransmitters play a big role in how we feel and in our mood. And so it's really important that we nourish that microbiome and make sure it's really balanced and really robust. And as you mentioned, making sure that our diets are alkaline and not acidic plays a big role. And so avoiding any sort of processed sugars or processed fat is really important in keeping the microbiome healthy. So any alcohol, anything sort of with sweets or sodas, you want to avoid. Honey and maple syrup are fine. They're actually very healthy. They're anti-inflammatory and actually keep the microbiome really balanced. And then stress can play a big role also in creating more acidity in the body. And so managing stress can play a big role in keeping that microbiome really healthy. We also want to make sure that we're feeding the microbiome so that it stays really balanced and healthy. And so eating high fiber foods is really important. So vegetables, multigrain, whole grains are really important. Beans and lentils are really important. And nuts and seeds are also really important in feeding the microbiome.
Excellent. So now we talk about all this food that, all this great food for our body and our microbiome, but how does that affect women and our overall health? And I mean, also it also affects men, but primarily women, as that's what we're going to be talking about. But how does that affect women with their hormones, their mood, their stress levels?
Yeah. So the microbiome plays a big role in hormone health, both for women and for men. And so when the microbiome isn't balanced, it can really affect the quality of our hormones and the balance of our hormones. And when we don't have a good balance in our hormones, so if there's not a good balance between estrogen and progesterone for women, and there's not a good balance between estrogen and testosterone for men, that can really affect the way that we feel. And we see that when we have, symptoms of PMS, that's an imbalance in that estrogen progesterone balance, or when women are going through that sort of change into perimenopause and menopause, and they have some mood dysregulation during that period of time as well. And that's also an imbalance in that estrogen progesterone balance. And so the microbiome plays a big role in the way that these hormones stay balanced. It also plays a role in the quality of the hormones. Mm-hmm. So when you have a lot of inflammation in the body that's caused by stress, that's caused by sugar, that's caused by poor quality of sleep, all of these things cause systemic inflammation in the body. And inflammation in the body changes the structure of our hormones, and it can change really healthy hormones to become more inflammatory and become more prone to becoming cancerous. And so the microbiome plays a role in keeping inflammation low.
So is there a way that you can, or are there symptoms that you can, tell that there's inflammation in the body, and how, if so, what are they and how could you reverse it?
Yeah, that's a good question. So inflammation is generally seen whenever you have any condition that ends in itis. Itis usually means inflammation. So arthritis, so joint pain is a sign of inflammation. Fog is a sign of inflammation. You know, diarrhea or constipation can be a sign of inflammation. Rashes on the body can be a sign of inflammation. So there's all these different, it comes in different symptoms and different, depending on the organ system that's being affected. But there are some biomarkers that we can test for, something called high sensitivity C-reactive protein, homocysteine, sedimentation rate. Those are 3 biomarkers that I often look at to assess for inflammation in the body for patients. And usually I'm trying to address inflammation before it becomes a symptom in the body, because once you have symptoms, that's actually a sign that there's already damage in the body. And so a big part of naturopathic medicine is prevention. And so we use these biomarkers to look for signals that there's something, an imbalance in the body before it becomes a symptom. You also asked how to decrease inflammation.
Yeah.
Inflammation, so omega-3s are really important in decreasing inflammation. And so getting a good fish oil in the system can be really important. Managing stress is really important. And then doing things in the diet. So reducing sugar, reducing alcohol, reducing processed foods are really important.
When it comes to allergies, could it be a sign of inflammation, of bad microbiomes as well?
Absolutely. So allergies are considered one of something called an atopic triad. So it first starts off as allergies, and then eczema and asthma. So that's what's sort of considered the atopic triad. And the underlying root cause of that atopic triad is something called increased intestinal permeability or leaky gut.
Yeah.
And so when we have leak, that is the underlying root cause of allergies, eczema, and asthma. And what in my practice, when I address that leaky gut, that increased intestinal permeability, we resolve the allergies completely. So absolutely.
With psoriasis being the same.
So psoriasis is more of a, it is, yeah. So it's a different, it's not considered part of that atopic triad, but it is a dysregulation of the immune system oftentimes. And again, as we mentioned, 80% of the immune system is in the gastrointestinal tract. So addressing whatever inflammation is in the gastrointestinal tract can really help with the psoriasis piece.
So now, would you, obviously, your first defense would not be to prescribe pharmaceuticals. How could one lower that? So my first choice is never pharmaceuticals. I very rarely will prescribe pharmaceuticals unless it's an acute condition that can become more of a medical emergency. So I rarely have to prescribe pharmaceuticals. So, you know, when I'm looking at patients' imbalances, it really is an individualized approach. With naturopathic medicine, there isn't a protocol for what's going on because we're really looking at the patient and what imbalances are going on in that patient. So for example, with something like psoriasis, it might be there might be an inflammation component, and we'd want to, if that was the issue, then we'd address that. It may be a toxic burden component, and if that's the issue, we'd address that. It may be a nutrient imbalance issue, and if that's sort of what's going on, then we would address that. So depending on what the imbalance is for that patient, that's what we would look at and address. Excellent. And so now, you know, as women, we have our different stages that we go through. Different hormones are affected at different stages. Can you sort of walk us through the difference between each of the stages?
Absolutely, yeah. And, you know, underlying to any stage that a patient is in, you know, whether it's they're going through, you know, they're having PMS symptoms with their first period, or sort of their perinatal, or postnatal, and they've just had a baby and their hormones are imbalanced, or they're in menopause or menopause where hormones again become imbalanced. The hormones are becoming imbalanced in a little bit of a different way in each of those stages, but the underlying imbalance that for each of those stages we need to address is adrenal depletion. Your adrenal glands are the foundation of all of your hormones. And so when that foundation isn't strong, then it's really hard to balance hormones on top of that. So I've seen that with doctors. A lot of times they'll find, for example, as a woman goes into perimenopause, her estrogen or progesterone might drop, and they might address that. But what happens is the hormones bounce around a lot, and it doesn't stay stable. And it's often because that foundational piece isn't being addressed. And so addressing the adrenal imbalance is really important. Your adrenal glands are two little glands that sit on top of your kidneys in your lower back. And they produce two hormones. They produce cortisol, and they produce a hormone called DHEA. And cortisol is our stress hormone. And as human beings, we've evolved to have short bursts of stress. And then our body, those adrenal glands produce short bursts of cortisol. So, and that's very healthy. But in the modern world that we live in with, you know, relationship stress and work stress and noise pollution and traffic, especially here in LA. Viruses, exactly. We now have sort of this chronic level of stress where we're all at least to a certain level have stress all the time. And so the problem with that is then our bodies have this signal to produce cortisol all day long. And that is not the way that our adrenal glands have evolved, or really, it's not healthy on our adrenal glands because it really depletes those adrenal glands. And then over time, so initially we see cortisol going up and it's high, and then that's sort of the first stage of adrenal depletion. And then over time, cortisol drops, and then our cortisol levels are really low. And when cortisol is either too high or too low, it makes it really difficult for to balance all the other hormones. So really, at any stage of a woman or a man's life, it's really important to make sure that those adrenal glands are really well nourished. And one of my favorite herbs for that is ashwagandha. And I also like sitawari. Those are two really good adrenal nourishing herbs.
Sorry, what was the second one?
Sitawari, Sitawari.
What's that?
So ashwagandha, in Sanskrit, ashwagandha actually means woman of 1,000 husbands. And the reason for that is because for women who are having issues with fertility, it really improves fertility. And the reason it does that is because it nourishes those adrenal glands that then creates a really nice support for all of our reproductive hormones. So ashwagandha is it's sort of a really good nourishing hormone. And for women who are trying for fertility, and for women who also have thyroid issues, it's really important. If you don't have any thyroid issues, sitawari can be a really nice nourishing, what's called an adaptogenic herb that really helps to nourish the adrenal glands. And I really like to use it for women who don't have thyroid issues and who are sort of in that perimenopause, menopause sort of stage.
So now, sorry, go on.
Okay, and I was just going to talk about the second adrenal hormone, DHEA. So DHEA gets converted to estrogen and testosterone. So when we nourish our adrenal glands, I work with women from when they get their first period, and I love working with these younger women because I can talk to them at this point in their lives about nourishing their adrenal glands, because then it keeps their DHEA at a really nice level, so that when a woman is going into perimenopause and menopause, when their estrogen levels drop, then if they've nourished their adrenal glands from an early age, then that DHEA they're keeping that level of DHEA really healthy all the way through, so that when their ovaries shut down and they no longer produce estrogen, then our adrenal glands can take over and produce DHEA, which then gets converted to estrogen. So that transition into perimenopause, you don't have to, I've had patients who have no symptoms at all because they've nourished their adrenal glands and their body produces the DHEA that then gets converted to estrogen, so that when their estrogen drops, because their ovaries aren't producing any estrogen, the adrenals then are able to produce the estrogen that they need.
Wow, that's pretty cool. So now coming to the cortisol levels. So if, you know, a lot of times when you're perimenopausal or menopausal, your cortisol level is completely out of whack, as you mentioned. So is that something that prevents one from doing things, or can someone still have high cortisol levels and still be functioning and do everything else that they continue to do without using it as an excuse to not do things?
Yeah, so one of the biggest things that causes cortisol levels to rise is stress. And a lot of times, the virus or, work or relationships, that's not going to change. And so what I talk to my patients a lot about is having that sort of state of resilience and being able to manage their stress. And, as we go from childhood into adulthood, a big part of that maturity is being able to manage our stress. And so finding ways, whether it's through breath work, whether it's through meditation or exercise, or, doing a hobby that we really like, spending time with friends, finding ways that can really help us manage that stress is really important as an adult. Because it really, not having high levels of stress that isn't managed well really does deplete our adrenal glands, that over time will affect our health. And if we're able to manage adrenal glands and our stress well, then we can sort of control how high our cortisol levels will go.
Excellent.
So really it is in our control. It's just a matter of whether we want to do that.
Yeah.
Or not.
And I guess that comes back to everything else in life. We have that choice. We can control, what our outcomes are at the end of the day.
Absolutely. Yes. The power is always in our hands.
Yes. So Fred was going to say something.
No, I was just saying that prevention is key, right?
Yes, and that is I think there's definitely a place for conventional medicine, but one of the places where I think that they fall short is with prevention, because they aren't taught in their conventional medical school what to do until a person is already in a place of disease. So that when they look at labs, they don't know what to do unless the patient is outside sort of that, what they consider sort of reference range. And when I'm looking at a patient's labs, the range that I'm looking at is much tighter, because one, I want my patients to be much healthier than the average North American population. And two, I'm looking for signals to show that something is starting to go out of balance. So I might look at nutrient deficiencies, I might look at inflammation markers, I might look at toxin burdens, because all of these things, even though they're not sort of defined as a disease by conventional medicine, they signal that if the imbalance continues, we will get to a place of disease. And I want to prevent that.
Of that.
That's why we love you so much. It's all about prevention. We're actually coming to an end here. Do you have any final words that you wanted to, and Fred, did you have any questions that you wanted to ask?
No, I found it extremely interesting, very informative. Thank you very much.
Yeah, oh, you're very welcome. You're very welcome. The only thing that I might just add before I go is, really, I just want to emphasize the importance of a healthy diet, making sure that you're getting lots of whole foods rather than processed foods, making sure that you're getting lots of fruits and vegetables because they're full of antioxidants that are really important for our health, getting enough fiber. And for women, especially when our hormones are dysregulated, whether it's we're having PMS or we're going into sort of perimenopause, getting lots of foods that are going to be the building blocks for really healthy hormones. So lots of nuts and seeds, ground flax is really important because it modulates our estrogen levels, and getting lots of good fats like fish oil.
Love it. Well, it was a pleasure having you. And so here's some good news that we've got for you guys. So Dr. Fareen's actually agreed to come on once a month. So it'll be the third Thursday of the month. So stay tuned for her next topic. We'll see her again. And coming up on Tuesday, we're going to be talking about why breakfast is important. Then on next Thursday, we have a guest speaker again, Salma Dinani. She's a personal trainer, so she's going to talk about how it's good for us to exercise, especially as we're starting off 2021. And then on the 26th, Tuesday the 26th, we're talking about winter blues. And don't forget, if you haven't signed up, it's not too late. You can sign up for the 5-day reset that we start on the 18th. And so you're going to be able to detoxify your body, realign with what your body needs, teach your body how not to be craving those sugar cravings that we all love. That over the holidays, we've sort of gotten a lot more chocolate in us. I'm guilty of that for sure. But it'll just reset your body. So again, if you want any more information, get in touch with one of us four, and we'll be glad to help you out with that. And we will see you on Tuesday. Have a wonderful day. Bye for now.
Thanks, guys. Bye.